Okay, good afternoon, everyone. So this is the brave few that is wondering, okay, what is this all about today? So consider yourself the pioneers in getting the firsthand information here. So thank you so much for joining tonight. I know this has been planned in a very short time period. And the timing is critical because of just it's election season, and we thought this might benefit your chapters and your fellow members. But I also am so lucky to have this team here, and I just want to give the floor to President-elect Bob Gahol for a moment, and he will have a few words for us.
Hello, magandang hapon, magandang gabi. And I'm Bob Gahol, your president-elect. As you all know, Marlon, our president, is doing self-care. I'm so glad that he's doing that because he's been running 100 miles per hour since he took office. So I'm glad that he's taking that much needed break. But Jelani, thank you for initiating this program. I strongly believe in this because as healthcare providers, nurses, we really need to exercise our right to vote because it empowers us to advocate for crucial healthcare issues and represent our profession. So by participating in elections, we can influence policies that impact patient care, working conditions, and our own professional standards. So we must remember that voting is not just a civic duty, it's an opportunity for nurses to ensure our voices are heard in shaping the future of healthcare. So every vote matters to create a healthier community. So thank you all for joining us this evening. I'll turn this over to Jelani.
Thank you so much, Mr. President-elect. Very happy for the kind intro for everyone, and happy to be here. I'm going to share my screen. Okay, hopefully you see my screen and not my Target shopping cart there. No. So thank you so much for joining again. And I'm here to talk about the opportunity for you to learn about Vot-ER, so pronounced Vot-ER, not voter. I know in the beginning I used to call it voter, but it's Vot-ER. This is an exciting initiative to bring voter registration into the healthcare space. Vot-ER works to provide patients the opportunity to register to vote, as the reality is that much of our healthcare system and healthcare experiences are determined by the policies our elected officials implement. Vot-ER is a nonpartisan, nonprofit organization. So please keep this in mind through the talk. It's nonpartisan. We are not taking one side or another. This is really just focusing on voting and our civic duty to vote. It was founded in 2020 by an ER physician named Dr. Alistair Martin, and now it is in over 350 hospitals, clinics, organizations, and health associations across the 50 states. And there are 50,000 health professionals who use Vot-ER's resources and tools to support voter engagement. Vot-ER has been focused in the New York Times, the Washington Post, PBS NewsHour, and more. And I hope that you saw the press release yesterday that was sent out by PNAA, but we are now a proud partner of Vot-ER, and we're very good company with the National Association of Hispanic Nurses, ANA, American College of Nurse Midwives, and also the American Medical Association, among others. In fact, nursing is a little bit late to the game with Vot-ER. I only found out about it myself through a colleague. So I joined Vot-ER's Healthy Democracy Fellowship, where we learned how to engage patients and our colleagues in a healthier democracy. And physicians have been doing this for years. In fact, this Vot-ER group really caters to medical students. So while they're still in school, they're already working out of the framework that voting is a social determinant of health. So this is the agenda for today. And again, my name is Jelani DeCastro. A little bit about me. I'm an oncology nurse by background, and I work out of City of Hope in Southern California. And I'm the current legislative committee chair of PNAA. And I know I follow some very big footsteps behind Miss Mindy Ofiana, who was the previous chair. I'm excited to present to you all today because I'm talking to one of the most influential and educated and powerful groups in the nation. My fellow nurses, as you sit here today, whether you're in Hawaii or Maryland, North Carolina, wherever you are, you control the mechanism which will move the needle of healthcare in this country, if not the world. With this presentation, my goal is to arm you with a valuable tool to empower your patients and your colleagues. Here's our agenda for today. I'm going to talk about the link between voting and health, how Vot-ER helps, some legal FAQs, and how you can get involved to make sure that we have a healthier democracy. Again, just a shout out to these wonderful people who I've been working closely with for the past few weeks. It's a very supportive group. I was mentioning earlier that I've been part of other nursing organizations, but really it's just feels like home here with PNAA. Everybody's just been so welcoming and supportive. So everyone from Dr. Saria, Bob, Dr. Doliente, Carol, and Mindy, I really appreciate them so much. And also because it's October, I wish all of you a happy Filipino American History Month as well. So what is this all about? What's the link between voting and health? Have you ever thought about those two things being connected? Certainly 5 years ago, I was not into politics. I wasn't thinking about voting so much. I was thinking I'm in healthcare, that's none of my business. I didn't go into political science. I went into healthcare. I'm a nurse, and those kinds of things don't concern me. But, things happened ever since, the pandemic happened, and I started really looking at the collapse of healthcare organizations and systems that I thought would support us. And, I wanted to find a way to prevent what we went through in the pandemic to happen to future generations of nurses. On this graphic here, this is the Health and Democracy Index. If you look at it here, there's like a very faint outline of what the different states are. And so what this index is showing is that states with less voting access have worse health, while states with more voting access have better health. So a healthier democracy is one that votes. Global, national, state, and local research show a link between voter participation and health outcomes. So that's something to keep in mind as you ponder your place in how you are going to move forward as a nurse and your civic duties and ensuring that we are supporting healthcare in this country. So this graph right here, it's a little bit more involved, but I just want to point out that we can't begin to address the social determinants of health until we begin to address the structural determinants of health. So as it says there, voting is arguably the most important aspect of the political determinants of health. Voting plays a vital part in the structural and social determinants of health, and the results of voting have a huge impact on health-related social needs. So because it's election season, let's talk a little bit about maybe the ballot you received in the mail or issues that you're hearing about through advertisement. So in elections, especially since this is a presidential election year, we often pay attention to the top of the ticket. So meaning who's running for president, who's running for governor, those big offices. But the reality is that so much of what shapes our health is like really down at the bottom of the ballot, the propositions, sometimes some, smaller elections like in your community that you might think, oh, they're small, I don't really need to pay attention to them. But actually, those are the elections that have more of a direct impact in how you flourish in your community, on your health, your family's health, and even your patient's health. There are over 100,000 local elections across the US in this year alone. Those elections impact decisions about climate, which in turn have major implications on like respiratory health. Those elections decide who will be selected as coroners in some states. So depending on the coroner that's voted in, are they really examining the causation of, some deaths related to the environment, or, what kind of structural things in the city are causing premature deaths, or even looking at maternal related deaths. And these elections decide the laws that go around reproductive health, as you know, and that's been like a hot ticket in this year's election. So when it comes to our patients' lives and the rules impacting hospitals and driving health outcomes, many of those decisions are locally made. So it's really important to pay attention to the local elections. Here under the magnifying glass is just a kind of a deeper dive into social determinants of health. So how you go about your community, whether you live there or you work there, the health of that community really depends on, the schools, what kind of food is available, what the pollution is like, the drinking water, how much people are taking home from their work. All of these things play a vital role in health outcomes. So, as I mentioned, with the smaller elections, the issues at the bottom of the ballot have a much more direct impact on the health of your community. Think about who influences the health policies in your county or your city. The health department has elections, the school board has elections. So positions like that, they really have more of an impact on your children's health and your health. This is a talk for another time, but one of my passions is trying to inspire nurses to be more involved in not just the civic process, but also, perhaps considering political office, because imagine how much more of a healthier community we had if we have nurses in those very key positions deciding the health outcomes of the communities. So speaking of nurses, let's take a deeper dive in nurses' role in a healthier democracy. So looking at the United States, the nurses here have had their roots in advocacy. As you know, one of the primary roles of the nurse, one of your primary roles, is to advocate for the patient, whether it's in an individual or a community. So this photo here is from the late 1800s. Nursing was an emerging profession, and early nurses really recognized the importance of having the right to vote for legislators who would support and advocate nursing. At the time, women's suffrage was a controversial issue, even amongst the women. Some women thought that they should vote, some women thought, no, we shouldn't vote. And for the most part, nurses was a female-dominated profession. So there was a lot of social justice issues. And some of these women were actually even arrested and, jailed for their involvement in trying to advocate for women to vote and hold office. So these are the silent sentinels from 1917. And we all know that nursing continues to rate highest amongst the most ethical professions because we are advocates. We're the most trusted profession, and we have been for many years. We advocate every day for the rights of our patients, whether it's in the hospital, in the clinics, or in the halls of our nation's capital. So I applaud each and every one of you who are here on the call today for your involvement in understanding the impacts we as nurses have, because we are standing on the shoulders of those who paved the way for us to continue the work to serve our communities through social justice. So I'm going to pause here a minute, because if, this is about a healthier democracy in the United States, why do I bring up a map of France here? So interestingly, and this is the statistic that really stands out to me every time, Vot-ER came out of a realization of a major issue with our democracy and our healthcare systems here in the United States. So with the last census data, 72 million eligible people are not registered to vote in America. That's the amount of, or the entire population of France. So imagine it's almost like a whole country's worth of people here in the United States that are eligible to vote but don't vote. So think of millions of missed opportunities for people to have a say in their health and how health policies are shaped, but they just don't take that opportunity. So to me, this is really a stunning number of people who are not engaging in the civic process. But keep this number in mind, that's 72 million. I want to touch on that later on again in the talk. So why? Why is a whole country of France, 72 million, why are they not voting? Why are they not registered to vote? And interestingly, the study by the Pew Charitable Trust found out that 62% of unregistered eligible voters have never been asked to register. So that's why they just don't register to vote. It's not because they disagree with the political climate or, reasons like that. It's just because they get so busy in their lives, like many of us, we work long hours, we have family obligations, and voting is not top of mind all the time, or when we think about it, maybe the voter registration deadlines have passed. But imagine that 62% have not registered to vote simply because they've never been asked. And if you look at the percentages here, these are the places where people are generally asked if they've registered to vote. So there's the schools, there's maybe churches, religious groups, civic groups, family, friends, government agencies. So the DMV, there is something called the Motor Voter Act that was passed many years ago. So I don't know if any of you have renewed your driver's license recently or have been to the DMV recently, but there was actually a law passed where when you're renewing or getting your driver's license, they'll ask you, are you registered to vote? Because they're capturing a large amount of the population that way. And of course, candidates or political groups, they have a vested interest in making sure people are registered to vote. So no presentation is complete without a Venn diagram. I'm sure that maybe in your daily work you come across a lot of statistics like this, but I really like this diagram because I think it really calls out the population that is the most affected by health policies, but also that don't have a voice in influencing or creating them. So when you look at the top three groups of people who disproportionately make up those 72 million, so remember the map of France, so that's 72 million people. Who makes up most of that group? Well, there are people who are young, people who are low income, and people who are of color. So, uh, like us here and as Filipinos, like we know relatives, maybe even ourselves or people in our community that make up this number. But yet those are the people that also are underrepresented in health policy decision making. So when you see the patients who come in to see us for their low acuity complaints and the patients who are most marginalized by our healthcare system, it's these same three groups, the young, low income, and people of color. So they don't have a voice. So how can we as nurses empower them to have a voice, or even, just give them resources, educate them that they do have a part in our democracy? So imagine, what if these patients were asked to register to vote? 72 million. And not all of them are going to vote. I mean, that's just the reality. Everyone that's registered to vote doesn't necessarily vote. But you're talking about millions of people that will have a voice that can influence their communities. And again, too, this is not just the presidential election. These are elections and ballot measures in your state. So, are they voting on how clean the water is? Are they voting on the types of food is in their community? So that's very important that everybody has the opportunity to vote. So let's talk about what is our role in all of this? So interestingly, when you look at the healthcare profession, so pharmacists, registered nurses, PAs, dentists, and physicians as well, we are 12 to 23% less likely to vote than the general public. So that's also a very staggering statistic because, if you think about nursing, we're the most numerous, we're the most largest healthcare population. I would say nursing is even the most educated profession. How many certificates, multi-certificates do you or your colleagues have, or master's prepared, DNP, PhD prepared, right? But yet we are less likely to vote. And again, there's multiple reasons, long work hours, other obligations. But again, for the most part, maybe we just don't think about it. So a 2021 study from the Journal of Internal Medicine found that health professionals are 12 to 23% less likely to vote. So what does it mean for our healthcare system when health professionals like us, the people on the floors of hospitals and clinics who really see the impact of policy on our patient populations and our institutions? So we see all the downstream effects, but yet we don't vote. So what does that really say about us as advocating for our patients? So it's not enough to advocate for our patients within the hospital walls, but beyond the bedside as well. And this is also a wonderful study that came out of the American Medical Association, where they recognized in June 2022 that voting is a social determinant of health. So the American Medical Association, in recognizing this, other organizations have also made similar statements, including the American College of Physicians. Yet there's no nursing group really that has made this statement. As I said, nursing is kind of late to the game on this. It's a lot of physicians, a lot of PAs. But I think it's our role. We're one of the, how do I say this? Not the few nursing organizations associated with Vot-ER, but we're one of the earlier ones. So I think after our involvement here, hopefully we'll inspire many other nursing organizations to join them as well. So, and this is just more information for medical schools and teaching hospitals, how they can support an inclusive democracy by encouraging civic health amongst their students. So the medical schools, they really start at the student level, at the medical school level, because as the students go into their fellowships and residencies and so forth, they already have that in their framework, in their approach to patient care. So I want to say that, this is a big call for nursing. For those of you in academia or those who know colleagues in academia, this is something I wish that nursing rethink about, because for the most part, advocacy and these types of issues don't get into the curriculum until the master's level, where I really think that, it should be health policy and so forth should really be introduced at the undergraduate level. But that's my opinion. So that's some background. And how can Vot-ER help in what we should be doing as a healthcare profession to further a healthier democracy? So the health space has a unique opportunity to help, as you see in this slide here. Healthcare professionals are the most trusted profession. And so if we ask patients or recommend patients something, they're more likely to trust us because they know that we are concerned for their well-being and health, like we are coming from a good place. So let's look at the tools that Vot-ER can give you and your colleagues, and how you can utilize them in your workplace or your organizations. So Vot-ER creates easy-to-use, nonpartisan tools and programs for civic engagement. And when they say civic engagement, it's really the voting piece. Like, how can we increase voter registration? How can we encourage people to vote? So I would say most people here, if you are whether in a hospital, a clinic, an office, or anything, you have a badge like me. I was wearing mine earlier today. So they utilize their badges, lanyards, non-obtrusive types of information that you can share this information with patients without like appearing like you're on a soapbox or anything like that. So in partnering with Vot-ER, PNAA has assigned to us, lanyards and badges. So if you were to order one today, and I will go over how you can order one, every time you have a conversation with the patient, they scan your badge, PNAA can actually track engagement and see how our voice as Filipino nurses is really getting out there to engage the public. So that's a very exciting thing. Lots of resources and tools, and you don't even feel obligated. You won't feel obligated to necessarily use them. As you can see from my lanyard, it just says, "Are you ready to vote?" And so you don't even have to have a conversation with the patient. They might like open the conversation with you, or they just see that, and maybe later in the day they really think about the question. So this is what I was touching on earlier. The tools are undisruptive. They're optional. In my organization, and we can get into the legal FAQs later, but in my organization, in an administrative role that I have, I feel more comfortable wearing the lanyard versus the lanyard and the badge. But there are organizations that the HR and all the powers that be in that organization, they've actually given their blessing for their staff to like wear the whole thing there. So I know we're always looking for ways to show our commitment to voting rights and health equity, and registering our patients with Vot-ER is really easy through these tools. So even though Vot-ER has only been around since 2020, it's really made a lot of momentum out there. So it provides the structure to support health organizations and health professionals. They have civic health partnerships for hospitals and associations. There's multiple community civic engagement programs and healthier democracy campaigns for professional students or health profession students. So in reality, these conversations take up a small amount of time each visit. So for those of you who are patient facing, you're doing an intake, these are questions we ask anyhow. Do you smoke? Do you drink? Are you wearing a seatbelt? Are you, when you're, addressing like possible domestic abuse, things like that. These are questions we ask. So what if you just throw in another question? Are you registered to vote? Just that. And if the conversation evolves from there, like the patient might say, well, what does that have to do with my visit today? Then they can scan the badge if they're interested, and they take it from there. You don't have to, continue to have the conversation with them. It's just really empowering them with the knowledge and the resources. So because Vot-ER has worked with multiple organizations and has had a lot of exposure in the press, the good thing is that healthcare not only has a voice like in print media or in interviews, but it is a way for nurses especially to get out there and become visible. For the most part, nurses are behind the scenes. During the pandemic, I want to say there was a very, very low number of nurses that the media actually engaged in their opinion about, the reaction to the pandemic or what kinds of things their organizations were doing. So this is really a great opportunity for nursing to be more visible in media and to amplify our voice. So look out and maybe the different organizations you're in, maybe you might spot someone wearing this lanyard, and I know it's making its way out there slowly but steadily. And just some more statistics here. Vot-ER gives a sense of belonging and groundedness to participating healthcare professionals. A lot of people are saying that they find a renewed sense of purpose in their job, in their organization, because they feel like they can impact healthcare in a way that they've never impacted it before, with 79% saying that Vot-ER helped increase their sense of personal agency to affect change, and 50% saying that it helped prevent them from workplace burnout. As you know, nurses will get frustrated because of the system in the hospital, their boss, their administration. And the reality is there is only so much you can escalate things in the hospital. My role as an administrator in my organization, I mean, there are things out of my hand that they are government regulations and mandates and all that. So if we really want to create change, it's about even going further up there's a phrase that you may have heard that goes, if you don't have a seat at the table, you're probably on the menu. So I don't know if you've heard that. So let's have our seat at the table. And if there's no seat, let's create one there, because we definitely don't want to be on the menu. So you're probably going to ask yourself, okay, I'm eager to do this. I'd like to start, but am I going to get in trouble? Especially, those in a healthcare system or organization with so many rules and regulations. So again, too, there is power in numbers. So there's a lot of precedents for this. Many physicians are already utilizing this tool in their organization and their practice. But just so you have some safeguards as well, this is the legal FAQ. There is a long-standing precedent and federal guidelines for voter registration in 501c and 3 spaces. So these organizations may conduct nonpartisan voter engagement activities designed to help the public participate in elections. So actions such as voter registration, voter education, get out the vote, these are all permissible with these type of 501s. The National Voter Registration Act in 1993 actually encourages this type of nonpartisan registration in healthcare centers. So as I mentioned earlier too, at the DMV, when you renew your license, and I renewed mine recently, so am familiar with this process. They're equipped with asking people if they're registered to vote, and it's just click of the button here and there, and they're able to update your voter registration for you. As far as IRS guidelines, Nonprofit Vote has released a set of legal guidelines to help nonprofit organizations understand what they can and cannot do in regards to voting issues. So 501c3 organizations may conduct nonpartisan voter engagement activities designed to help the public participate in elections, such as voter registration, education, and get out the vote. Now, in terms of endorsing candidates, that's a whole different conversation altogether, and there are separate IRS and legal rules for that, depending on that type of 501 organization you are. So how can clinicians and healthcare organizations take the next step? So point out patients to Vot-ER, or show your Vot-ER badge, posters, handouts, whatever types of equipment that you're permitted to have in your clinic. Show them to patients. You can also share with your patients that their institution offers a service to help them to register to vote, but you do not endorse any political party. Or you can even help them fill out a voter registration form while remaining neutral, much like filling out a form for public assistance. You have social workers that help with that in your institutions or things like that. So what is the next step? What is our call to action? At the very, very simplest, and it's free, I want to stress this is free, you can order a Vot-ER badge. And the QR code is there. We'll send out a code in the email as well, a follow-up email if you missed the code on here. But at the very least, order the badge. It comes in a nice kit. You get a lanyard as well. And if you order specifically through this QR code or through the link below, it ties it to PNAA so that we can follow how much our members are engaging in the Vot-ER Healthier Democracy campaign. So that's kind of a neat dashboard for us to see how our membership is reacting to this, or if there's no movement on it, what more can we do to engage our members? So this is an easy way to get involved, still non-committal, even though you get your badge. You might just sit on it for a while before you start utilizing it. And then I'm wrapping up here, and I do want to just call out a quote from Dr. Alistair Martin, who is an emergency room physician. I mentioned he founded Vot-ER, and he's working out of Harvard right now. So this is one thing that really motivated him to form this nonprofit. He said, "I can keep writing prescriptions for my patients' asthma, But without Vot-ER, we cannot effectively empower patients to have agency over their own health and effectively advocate for cleaner air. So it's like that saying, are you going to make someone a fish sandwich, or are you going to teach them to fish, right? So by empowering patients and how they can have a direct impact in their health through voting, through knowing what issues are important in their community, we're really setting them up for a lifetime of being empowered and involved and having a voice versus us just fixing their issue at that moment and then saying goodbye to them as they leave the hospital or the clinic. So with that, I wrap up my presentation. I thank all of you for listening. I know this is a lot of information, but at the very least, I just wanted you to see that there is a relationship between voting and healthcare. And we as nurses in one of the most influential and most trusted professions, we really have an obligation to really empower our patients, empower each other, and we can change healthcare for the better in this country. We are an untapped power. There are 4.5 million of us. At the time of the pandemic, there was 6.5 million. Unfortunately, we lost a lot in the profession. But still, that is a very, very powerful number. Nobody knows the untapped power nursing has yet. And I don't even think nurses know that. But when we recognize it as a profession, little by little, we are a force to be reckoned with. So keep that in mind. I hope that you share this information with your colleagues, or at the very least, just ponder it some more and see, if it speaks to you in any way. But I am excited to be part of PNAA, and I'm committed while I'm in this position to really elevate our voices as nurses, but also as Filipino nurses. So I really thank you so much for your time. I think we have time for comments or questions, Carol, so I open the floor to anybody.
Okay, since there's not a lot of us here, but you can go ahead and ask questions. Please raise your hand. Or Lenny,
Hmm?
that you? Okay. I thought you were raising your hand, Lenny. Okay. Um, Greta here says, excellent information. Wish I had known this much earlier. Our chapter will be at one of the biggest event in Texas Saturday. Thank you, Greta. Risa, go ahead, Risa.
So hi, thank you, Jillian. This is really wonderful. Thank you for presenting this to us. How I wish there were many of us here today, and I do truly believe in advocacy. I have used Vote-ER before, and through my children, actually. As physicians, they have this drive in Dallas. But I'm wondering, for one, can we have a copy of your slides so I can send it to all the chapters? Being the
Absolutely.
RVP of the South Central region, I actually send the link that Carol gave to all of us to them to share so they can come. And hoping that they can attend. But the time is 5 o'clock here for the presentation. So they all for sure still working. Right. So if I can send this to the chapter. Number two, I just wanna, not necessarily from you, but from everybody. When you talk to family, I work in an intensive care. When you talk to the family about voting, when the first thing in their mind is a sick child, right? It's usually put at the back corner. So what is your strategy when you are in that situation? And number two, sometimes, when you ask them, have you registered? It doesn't sit well in a lot of people. So I changed my strategy instead of doing that by saying, have you heard of? And I say about this one. Because some people doesn't really like when you ask them that question. I'm not sure what's your experience or other people's experiences are.
Yeah, I think that's the challenge too, because in many of our work environments, I mean, it doesn't come up in a natural way, and it's been ingrained in us. We don't talk about politics, we don't talk about a religion, or in mixed company, or in our workplace, certainly. But I think we do have that extra layer because we are healthcare professionals and we have a responsibility to our patients, at least arming them with the resources. And you don't have to be um, like involved in all these emails with what ballot measures, propositions, all of that. I think just it's good enough to know that, you know, when elections are coming and you have an opportunity to vote, to take that. And perhaps in a situation like that, you know, if the occasion arises, it's just mentioning that maybe even on the school level, like if they have children, if they, again, bring it to the community. But on the school board, those are elected positions. In the health departments, for the most part, they're elected positions. So, you know, think about it from that lens of, you know, who in their community has been elected into a position that's affecting um, the health care of their child or their family. Sometimes in health system boards or, you know, regents of a health system, those are elected positions as well. So again, too, it may take more than one conversation, but at least just getting it out there. But yes, it takes a lot of practice, I think, in opening those conversations.
Hi, Jelani. Thank you for that excellent presentation. The QR code behind on our Zoom background, that's the QR code to get the badge, right? And I hope everyone that's in this webinar has that QR code so they can request for a badge. I just want to share when I was working, you know, my background is military. We actually have a volunteer position during elections. It's an extra duty for our military personnel to serve as voting assistance liaisons. So that uh, voting assistance liaison actually they go around the units to ensure that our service members are registered to vote. So and it still does encourage everyone to vote because this is really, really important.
Yep.
Thank you.
Great presentation.
Thank you, Bob. Yes, Mindy?
Oh, I don't have a question, but a comment. I used to work at Kaiser Permanente, and they do have I worked at City of Hope too. So they do have a policy, not policy, but they do encourage, or the right word is they advocate for absentee ballot. So if you're in the hospital, they do encourage the absentee ballots. And also we do have an employee, we encourage employees to vote, that they can vote first and can come to work late if they are voting, and can leave the facility early as well if they want to vote. So that's, I in that facility, I believe, has engaged in a lot of advocacy with regard, especially with voting. I've seen that because I worked there for 13 years. So anyway, thank you for this webinar, and you raised legislative committee higher. We used to just do position statement. All right, so thank you very much.
Thank you,
Thank
Mindy. I was sharing with Jelani that this is the first time we're doing a voting webinar. And, we really thank her for doing this. Any other questions, comments? By the way, we are recording this, and we will be sharing the link through
That's good.
our social media. We'll also send it via community bulletin. And if you're okay with sending your slides, we can send it to our members.
Oh yes, I'll send out the slides. And also I just wanted to say, either if you contact me or Carol, Vot-ER has sent out social media slides. They're already made, and I think we can add our logo, or our logo is already there, so you can just post it on your social. It's easy already. They make it as simple as possible. And I really wish, I was telling Carol earlier, I wish we had more time to plan, but time is of the essence right now. But even past the election, there's so much opportunity for for us to get involved and, you know, at least prepare so that we have more people invested and engaged in voting for the next elections, right? So nursing, I keep saying, we're a very large and powerful profession, but of that percentage, Filipino nurses make up such a bulk of that number, right? But yet our voice isn't as loud as it should be yet, but we will get there. So I'm very, very excited for the future, and under Dr. Saria's leadership, I know that we're going to reach the next level there. So I'm very excited to work with all of you. I'm happy to always be a resource. You can reach out to me. Again, I thank you for being here today.
Yes, I have a question.
Go ahead.
You know, Ms. De Castro, you know, when it comes to politics and election, the discussion is endless. But can you have give us some tips, you know, how to begin it comfortably, you know, because example, I need to discuss this with my neighbor who is really very, very negative about these things.
You're muted, Yelena.
You're muted, Jillian.
Sorry. Thank you. That's a good question. It's a very good question. And I think something that guides me is, you know, when if the conversation comes up and you know, it leads to politics, from the nursing lens, from the healthcare professional lens, I always want to approach it from a nonpartisan education standpoint. So you may not agree with the person you're talking with, or they may be negative, but if you focus on healthcare, like, who doesn't want quality healthcare? I mean, it might start getting trickier when you're talking about overseas affairs and things like that. But I think healthcare, as healthcare professionals, it is a safer place for us to start because we are subject matter experts in that. It's similar to our patients in the hospital. We have like skill sets to build rapport with them quickly and encourage them to comply with their treatment plans. I mean, at the end of the day, they're still going to do what they want, but we have skill sets as nurses, to build rapport with them, to educate them, to meet them where they're at. So I think you know, if you don't want to engage in something that's going to possibly close the conversation, or, you know, have it end in a negative way, but you want something that will inspire them to dig more questions and continue a second conversation with you. So like, what is it in that conversation that will pique their interest so they'll have a second conversation with you? So that's one tactic. I mean, that's for hundreds and thousands of years, politics is very contentious. I mean, if looking back in the Philippines, right, how contentious it can be there as well. So I think we definitely have a voice, we have a space, we have our expertise to back us up in this when we're talking about healthcare. Because again, who doesn't want quality healthcare? For everyone, for their family. And, you know, just remember too, when you're having these conversations, especially as it goes around healthcare, you have so much influence, because whose life in the United States hasn't been touched by a nurse? Either they've been taken care of by a nurse, or they are relative to, you know, with a nurse. If you're Filipino, half your family or more is a nurse, right? So we have we have our numbers to back us up in all of this. So again, it takes practice, it takes knowing your audience, but you can definitely use your skills as a nurse, a bedside nurse, and assessment, all of that, to tackle these conversations.
I agree with you because I know as a nurse myself, and I truly that you know, we provide care without prescription.
Yes. Yeah, I would say it's something that is an easy step, I think, to get into advocacy, is realizing that to lean on the nursing process, the assessment, diagnosis, implementation, planning, evaluation. you can go into conversations with that framework, like assess who you're talking with, see where they're at, and then you can diagnose and plan and implement from there. So it's difficult in the beginning. And again, too, you don't have to take a political statement. I think one of our biggest roles is just to really engage people in being part of the civic process, because the more people who know how to vote or are registered to vote, the better we're all at, whether or not they vote the same way as you, but at least we have more people voting.
True. True.
Amen to that, especially this coming election.